A 64-year-old woman present to her physician with swelling in her extremities. Palpation produce significant bleeding. Which of the following conditions present the most likely physiologic basis for the physical finding? Number first, decreased capillary permeability, decreased capillary pressure, increased interstitial fluid pressure, increased interstitial oncotic pressure, increased plasma protein level. So there is a formula which help you in order to identify that the net fluid movement is equals to Kf into capital P C minus capital P I minus small p c minus small p I. So this is an equation which help you to know the net fluid movement, whereas the K is a coefficient of the filtration, okay, the factor in membrane permeability, Pc is a capillary pressure, Ip is interstitial pressure, C small p is an oncotic pressure into the vessel or the capillary oncotic pressure, and Pi is a oncotic pressure of the interstitium. So I make here a vessel, okay, this is the blood vessel, in here the present water molecule and also the plasma protein which is responsible for the retention of the water into the vessel. So if in case the oncotic pressure here decreases, there is the oncotic pressure into the blood vessel decreases, okay, then what happened? The fluid start to leak out. This is the first factor, that the decrease in the oncotic pressure of the capillary. Number second factor, that is the decrease in the interstitial oncotic pressure here, okay, oncotic pressure. If the oncotic pressure into the interstitium decreases, then what happens? The fluid can not come to the interstitium because here the retaining ability of the water is less. So if in case the interstitial the oncotic pressure increases, okay, or the protein, for example the plasma protein now start to accumulate here, okay, or anyhow due to some salt concentration or any ion increase here, so what it do, it attract more water from here. So increasing in the oncotic pressure of the interstitium, what it do, it attract more water here. So and increasing in the pressure of the interstitium, water pressure, if the water pressure here increases, the water will not come from here, rather the water go like this, it will enter into the vessel. So increasing in the pressure, the water pressure, the hydrostatic pressure of the interstitium leads to the movement of the fluid from the interstitium into the vessel. If this oncotic pressure decreases, this hydrostatic pressure decreases, then what it do, the water start to move from the vessel into the interstitium. What is the effect of the pressure of the capillary? The capillary pressure is mean that if the hydrostatic pressure into the capillary increases, definitely the water move from the vessel into the interstitium. Rather, if the capillary pressure anyhow it decreases, so what happen? There is the net flow of fluid into the vessel sometime, okay, not only. So let us find the answer. Decrease capillary permeability, no. If the permeability decrease, there is no net flow of the fluid from the vessel, this is not. So decrease capillary pressure, no, again not, okay. Increase interstitial fluid pressure, as I said that if the interstitial fluid increases, then the fluid start to move from here to here, but it doesn't come from the vessel because the already pressure of the water is here is more. If the pressure is more here, then water definitely it will not move from the vessel into the interstitium, so it is not answer. Increase interstitial oncotic pressure, yes, it may be thing, because if the oncotic pressure increases here, the salt concentration of the plasma protein concentration here increases, so it attracts more water from the blood vessel and the formation of the edema is occurring in this patient. So we can choose this one till now. And what about the E, increased plasma protein level? If the plasma protein level increases, the fluid retained here, it will not come out. Okay, so the best option is increase interstitial oncotic pressure, which leads to the formation of edema in this patient.